My name is Mairead Egan. I'm representing the UCD Centre for Emergency Medical Science in Belfield. I'm here this morning to talk to you about one project in particular, the Mairead project. Mairead, Medical Emergency Responders Integration and Training. The image on the screen is a bunch of North Dublin GPs who are involved in the Mairead project, and the smile on their face is a result of getting all the free equipment and training that UCD provides for them, courtesy of FEC, who are the principal funders of the Mairead project. So that was taken over in the HSE offices in Swords a couple of years ago. So just a little bit of background of who we are. So there are 1,200 graduates of the Diploma in Emergency Medical Science. They are the paramedics in principle of the National Ambulance Service. There are 330 recipients of the Graduate Diploma in Emergency Medical Science who make up the advanced paramedics of the National Ambulance Service and Dublin Fire Brigade. We have a number of master's projects underway and a number of PhDs. These higher degrees are becoming increasingly popular among advanced paramedics and other healthcare providers. And the big plan, inshallah, is that in 2015, September, will be the first intake to the 4-year Bachelor of Science degree in Emergency Medical Science. So we're all very excited about that, and there's huge support for it. For the past 20 years, hence I have to get my highlights done every 3 months, we've been running immediate care courses for GPs all over Ireland. They come to Belfield, we go around the country to them, especially the Cork people, because Cork people don't travel. So if we want to get the GPs in Cork, we've got to go to Cork. So we run one-day courses in cardiac trauma, thrombolysis, paediatrics, you name it. So we've been doing that for many years, before CPD was ever formally introduced for GPs. We contribute to every module in undergraduate medicine, right through from CF4 to ALS. And finally, our other strand would be our research and development strand, which is what we're here today about. So the Mairead project has 100% coverage across the Republic. So there are 2,600 GPs in Ireland across 2,000 practices. 1/3 of the GPs in Ireland are single-handed, as in sole practitioners. So Mairead has managed to capture 508 of those practices, which is nearly a quarter of the GPs in Ireland. This means that 508 practices in Ireland are equipped and trained to manage cardiac and trauma arrests in the community. So just to zoom in on some of the areas, so that's obviously the northwest on the left and the area that we're in now on the right. The red dot represents a practice that's equipped and trained to the Mairead spec. You can see another one there, the southwest. So we're all very well placed, and we're in very good hands when it comes to the training of our GPs. So the publication I'm going to talk to you about is July 2013, Cardiac Arrest Management in General Practice. We looked at GP managing arrests over 5 years, and you can see my colleagues there, Gerard Bury, Mary Hayden and Dr. John Dowling. So we had 495 practices signed up, which represents a quarter of the practices. They got a defibrillator, they received 2 days training, and in return for this they agreed to collect data for us, to tick a box every 3 months to say whether or not they had been involved in a cardiac arrest. So they got an FR2, the Philips Cardiac Services model. It also has 3-lead capability. It has the all-important data card, which is what we're interested in, where we can download the arrest information. The GP responds by a quarterly survey, and what they report are what we called a CARA, a cardiac arrest resuscitation attempt. So that's what defined whether or not we would capture a report as an event. So the results of that study, which was published in the BMJ Open, were of the 495 practices, 36% reported being involved in a CARA, a cardiac arrest resuscitation attempt. That's actually 178 out of the 495. So a small number of practices were involved in more than one, and in fact some practices reported 2 and 3 events over the 5-year period. So that was 13%. A total of 272 CARA reports during the 5-year period. Return of spontaneous circulation, ROSC, was achieved in 32% of these. The discharge from hospital rate was 18.7%, which is very encouraging. This means that 49 patients out of the 272 survived cardiac arrest to the point of discharge from hospital. It's worth noting that rural practices experienced twice as many events as urban and mixed practices. However, the survival rates across all areas were the same. So as a result of this data, we're able to decide now to only put defibrillators in remote and rural areas where they're being used more. So the role of the first responders were significant. In 14.7% of the cases, the first AED was brought on scene by a layperson, which would be one of you guys. So there was, again, a 2-to-1 urban-rural balance there. So the first responders were twice as likely to be there in rural areas as urban. There was year-on-year variability of responder participation, which we've no explanation for and would probably be worth studying. So over the 5-year period, the level of responder activity didn't go straight up in a line or didn't go straight down. It varied, so interesting. With regard to general practitioners, in 45% of the cases, the AED was brought first by the GP. In 65% of cases, the GP was there before the ambulance service, which you can imagine would be quite the case in rural areas where GPs are living and working in their community and would often be the first point of call while waiting for the ambulance service. 47% of the cases occurred in the patient's home. So what we can conclude from this is that cardiac first responders have an important role to play in the care of emergencies in their community. GPs are clearly providing prompt care, which results in successful outcomes in all settings. We've 2 projects which are underway. We've one project which has just begun, which is where we've a pilot GP response to the National Ambulance Service on cardiac arrest. So we've small numbers of targeted GPs in specific areas who have agreed to be available to be called by the ambulance service where there is an arrest underway. What we would love to do, and maybe to think about today, is to do a 5-year study on the role and value of first responders, just as we have done for the GPs in the Merit Project. So the take-home message today from our study is that there is significant contribution by lay responders to cardiac arrest management in the community, and long may it last. And can't resist the opportunity to bring you all back up to Dublin again. I know there's a lot of registered healthcare providers in the room today, as well as lay responders. So UCD Centre for EMS are showcasing both our internal research and the research being undertaken by our Masters and PhD students. So that's on the 26th of April. And you can see there our website, UCD/EMS, and I just got the time up signed. So I'll finish up by thanking our stakeholders, and in particular the Pre-Hospital Emergency Care Council under the superb leadership of Dr. Jeff King. So thank you very much.